but I mean, we'll go over it 50 billion times. But it's totally up to you, however you want to do it, yeah. Okay, so here we have our medication vials, right? Of course, this is just water, as you guys know, right? So on your medication, what you're going to be looking for is the name of the medication that you're giving, because your doctor has ordered it, okay? Doctor orders 250 milligrams of amoxicillin, okay? So you're going to go and you're going to go ahead and pull out your amoxicillin or whatever it is that your doctor has ordered, right? So you're looking at your vial. Yep, there it is, blah, blah, blah medication. So-and-so amount, 250 milligrams. You're going to look on here and make sure, right? The other thing that you're looking for is on here, it's going to say a lot number. L-O-T is the lot number. So this tells you where was it manufactured, when was it manufactured, what company manufactured it. Okay, you guys have all heard of recalls when they call in and they say, oh, Tylenol, we found metal in the batch of, 405030, whatever, blah, 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 right? So they have recalls. So what happens is they go and they pull it. So they look and they see who ordered this medication during that time frame that is equal to that lot number. Does that make sense? So Dr. Smith, thousands of people, okay? So then they go and they contact each one of those offices, okay? And then they look and see who was seen within that amount of time and pull all those charts and look and see if those people had that medication. Does that make sense?
So auto recall.
Yeah, it's huge. It's a major problem. But they have to write down this lot number. So when you guys are documenting in the chart, you're writing down, okay, blah, blah medication, such and such milligram strength, the lot number. You're also looking at the expiration date. When does it expire? Okay, so you want to make sure you're not giving expired medication. Now, the other thing you have to do is when you open a brand new vial, okay, you're going to write on there the date of when you open it. See, this one's not open yet, okay? So you do this. I wanted to flick that so bad. I was good, okay? So when you open it, you're going to write on there the date that you open it, because certain medications can only be on the shelf or have a shelf life of a certain amount of time. They're all a little bit different, okay? So, and you can read up on it from the manufacturer of how long it's allowed to be opened and up on your shelf. But you need to write that date on there, so I'm going to do that in a minute. Okay, so those are all the things that you need to know about your vial. So, what is the medication? What's the milligram strength? How much is in here per cc or per ml? Like, let's say that the doctor orders 500 milligrams of blah blah medication, okay? And you pull this off the shelf and it says blah blah medication. Yep, that's the one you want. But what if it says 250 milligrams per 1 cc or per 1 ml? But the doctor's ordered 500, so how much are we going to give? Two. Does that make sense? So you have to look on here and see how much milligram strength is per 1 cc. Sometimes it'll say per 2 cc. Sometimes it'll say per half. So you have to read your label and find out how much is in each cc, or what is the milligram strength that is in this particular vial, because they do come differently. Okay? So yeah, good old math. There you go. Okay? So you want to make sure that that's what the doctor ordered, and if it's not, then you have to make it work. Okay? If you're not sure how to do the math on that, go ask. Show your doctor. Okay, I see that here on patient such and such, you ordered blah, blah, blah amount, but this is all I have. How much should I give? My calculations say I should give 2.5 cc's or whatever you're able to figure out, okay? So you're going to confirm that with your doctor, okay? So medication, what's the milligram strength? You're going to write down the lot number, checking on the expiration, and also how long is the shelf life. So those are all the things that you need to know about your medication vial, okay? Now, we talked about this already, your needles and your syringes, right? So 27 gauge again is how thick is your needle, right? The diameter of your needle. And then this one's by, what's this one? Half inch. So this one's super tiny, okay? So this is the one that we use for allergy tests, we use for MMR, we use for a lot of different things. Okay, TB test. But today we're gonna use them as like TB tests. Okay, so it's TB, and you guys all had to have them if you hadn't had them done within what, the year, I think is what our guideline is. Okay, so that's what we're gonna do. Now, here's how we set up our tray. Okay, this is your Mayo stand or Mayo tray, and you'll see there's little swipes on here from people cleaning them with alcohol. First you clean it with alcohol, you swipe from the center, work your way out, and we're going to go over that more in detail when we get into sterile tray setup. Because in order for it to be a sterile tray setup, again, it's from the center, working your way out like a snail shell. Okay, same thing when you clean off the patient's skin, it's going to be like a snail shell from the center, working your way out. Okay, so we have our Mayo stand. Now we need our tidy towels, and they're right here in the little desks here. And you're going to see your tidy towel has two sides. One side is absorbent. You see that? Okay. The other side is shiny. Why? Because we don't want whatever gets on this to leak through onto the tray. So you put the shiny side down. Trust and believe at least one of you are going to wind up like this, and it's going to be great. And we're going to point, and we're going to say, ha ha. No, we're not. I'm just kidding. We're not going to do that. I don't know what's on this. Something from the box, probably. Okay, so we're going to put that there. Okay, we're going to put our syringe here. And please, let me beg you all, please make a dirty area and a clean area on your tray. Oh my God, that's so OCD. No, it's not. What happens is, if you don't have a clean and a dirty area, you're going to start grabbing your dirty stuff and try to clean off your patient with dirty stuff. We don't want to do that. So how do we make a dirty area? We come over here and we grab a little paper towel. Super fancy, right? And you're going to set this over here, and here's my dirty. It just keeps you organized. Does that make sense? Okay? So you're going to put this on here. And here's your syringe. Okay, I'm going to get my gloves, which actually, let's see where they're at today. I'm allergic to latex, so I have to wear these vinyl gloves. What size is this? Extra small. That's not going to work. See, and we go through these like crazy. Large, that's okay. It's not ideal, but these are what I have to use. These, they also have nitrile. Yeah, these are going to be a little big. These ones too. See these? Or let's see, powder-free, synthetic. Yeah, these ones are fine. These two. Okay. We need that. Okay. We also need our cotton balls. Here we go. Sometimes there's some over there too. Okay. And you're not going to reach in here and grab these cotton balls. Okay. Even though I just washed my hands, we still don't want to reach in there. So what you're going to do is you're going to put them on your tray like this. And please, when you're filling this up, okay, in the evening or halfway at lunchtime or whatever, don't pack them in there because you want it to look nice and full. When you pack them in there, you're going to wind up dumping 10 out on your tray. Little things that make a difference to make everyone's life easier, okay? So put them in here and make it full, but don't, right? Okay? Simple little things. The other thing I need is an alcohol, okay? So what I'm going to do here, this is my, see my clean area? Clean, okay? Here, here, okay? And when I open this, remember how I showed you guys? Drop it onto your tray, okay? So I can set this over here in my dirty area because it's done. We don't need it anymore. And what's the first thing we do with our syringe? You guys remember? Exercise the plunger. Right? Like this. Make sure it's moving around. Okay, and I'm going to go down to 0.1 on my plunger here on the very top of it because that's how much medication I need. 0.1 for this particular test. What I'm going to do then, I'm going to clean off. See this? So you push it and it kind of comes up out of here. Okay? You're going to clean off your vial. And what else am I doing? Yep, right medication. So we want to check. Right patient, right medication, over and over and over, 6, 7, 8 times, at least 6. Okay, the 6 writes, 7 writes. Some books say 6, some say 7. I think ours says 6. Okay, we're going to start in the middle. Work your way out, snail shell, cleaning off the top of that. Where does this go? Am I clean or dirty?
Dirty area.
Dirty, right? See, that way, if I just throw it over here, wherever, whatever, and then I use this for my patient, do you see that? No, put it over here, okay? So now, we have this, and remember, make sure this is on nice and tight. You're going to hold this one because this isn't a screw-on from this particular manufacturer, and we're going to do rainbow, right? Don't forget about the rainbow. Why? Because you're training your brain. Muscle memory. It looks ridiculous. It's really big, but eventually you'll just go like this. But for now, you're going to be doing it like this. We're training your brain. Now, we put this right in the center. Push it in. Air to air. So first, you're going to push in the plunger. Air to air. Okay? If we don't push the air in there, what happens is this is eventually going to collapse on itself, and every time you put a needle in there, it's going to start pushing it out 100% fast. So we don't want that. We want to create that negative pressure. Okay? So now I'm going to look and see what I'm doing. Okay, let's see here. And I'm right-handed, so I'm going to hold this with my left hand just like this. You're all going to do the same thing, and I'm going to walk around and help you. And I've already pushed the air in. And here we go. I'm checking again. Yep, such and such patient. I'm checking here on my chart. Yep, such and such medication. That's what the doctor ordered. I'm checking again and again and again, right? We already pushed the air in, air to air. Now I'm going to pull this way down really fast, past the amount that I need, because we need to fill in that space all the way up through here, okay? And I'm looking to see right here, and we don't want to push this sideways here because we're going to bend our needle, so keep it straight. And I'm looking here, 0.1, there we go. OMG, there's bubbles. Okay, tiny little bubbles are not going to hurt anyone. We are not injecting into veins or arteries ever as medical assistants. We don't do that. We are injecting into tissue or muscle or skin or whatever, but we're not injecting into arteries or veins. So these tiny little bubbles are not a big deal. If you see them and there's too many, just pull it back down again. You can flick it a couple times, but I don't want to see you guys over here doing this, obsessing for 3 hours, okay? Number one, we don't have time. Number two, it's not necessary. No, number one, it's not necessary. Number two, we don't have time. Number three, sometimes you can actually change the composition of your medication. So don't beat it to death. It's not necessary. Okay? Need to get rid of the bubbles. Just kind of go like this. And then we're going to push it back up until we get to the 0.1 marker. You see that? And we take it off. Boom. Set it down. And what are we using to cover it? One hand scoop technique. Okay? Boom. There we go. Now we don't have to push it all the way on. Okay? It's a little bit, loose here, which is fine, just like that. And then you're going to come over here. Hi. Now, she's not sitting ideal for me. What do? Do I compensate myself and lean over my tray and hurt my back and do all these things? No, I'm going to move her, or I'm going to move myself, or I'm going to move this, or I'm going to move that, or I'm going to do all of it to make it work, right? So she's fine right here. So I'm going to come over there because I need to be across from her. Okay? Here's the other thing I need. I need my tray on my right side. Okay, I'm going to move this around a little bit. I need my tray on my right side because I'm right-handed. And we never, ever, ever, be careful with that. See how it came out of there? You got to be careful. You don't want it touching your tray. Okay? We don't ever cross over the midline of our body. You see the midline? See how it's in the center here? Okay? We never reach over here for something or reach over here for something. That's how you will get stuck. Not a matter of if, it's a matter of when. If you do this, no crossing over. Do not cross the midline of the body. Okay? So I'm right-handed, so my tray is always going to be here on my right. So is my sharps container. It's right here, boom. Okay? So I can even move this over just even a little bit more so that I can go like this. Your sharps container always needs to be one step away from you. If it's 2 steps, it's too far. Bring your sharps in closer to you, or yourself, or your patient. Move things around to where you are within reach, where you need to be. Does that make sense? Okay. So I'm going to put on my gloves. Notice I didn't have my gloves on when I drew up my medication. Why? It's not necessary. I'm not exposing myself to any blood, body fluids, right, with drawing of medications, and I already had washed my hands. So this is ready, this is ready, this is ready. Now, for TB tests, we have to ask a lot of questions. You guys all had that when you were out there, right? Some questions I ask because I learned it from Kaiser, and Kaiser is a very high standard, so I teach it to you guys. Now, when you get out there in the field, some places may not ask certain questions, or they may have additional questions that they've added. It's up to them, okay? They all have different protocols, but there's still standards that you have to ask, okay? First of all, hello, my name is, you're going to introduce yourself. I'm going to be your medical assistant for today. Remember, you guys have been doing that with your vitals, right? The doctor has ordered a TB test for you today. I have some questions, right? And you also verify that your patient is your patient. Are you so-and-so? Oh, yes, here's your chart. Right patient, right medication, right chart, right order, right everything. Correct? Okay? So here's the questions that you're going to ask. Have you ever had a TB test done before?
Yeah.
Yes or no? If she says yes, okay, well, now we have to find out what those results were. If she says no, there's no results to ask for, right? So then we would move on to the next question. But she said yes, so I need to know. Were they negative or positive?
Negative.
I'm not sure. What does negative mean? What does positive mean? Some people are confused over that, okay? Now, if it's negative, that means that it wasn't raised up, there was no issues there. It might have been a little bit red, maybe a little bit itchy, but it's not a big blister, okay? When it's positive, it's raised, it's red, it's itchy, scratchy. They actually leave scars most of the time, okay? And if it was positive, what would have happened from that point on is they send the patient on for a chest x-ray. Why? Because we're looking to see, do they have tuberculosis in their lungs? That's the whole purpose of this test. Is it a red flag or is it not? A positive test doesn't necessarily mean that they have TB. It could just be that they're allergic to this test.
Or that vaccine.
Or that they have been exposed to TB somewhere along their line in their life, but they don't have active TB. So it could mean that also. So bottom line is we need a chest x-ray to make sure, do you have active tuberculosis in your lungs? That's what we're looking for, okay? So her results were negative. Now what if they don't know? Well, I don't know if it's negative or positive. I don't really understand the difference. Okay, well when they looked at it, what happened to you? Oh, well they sent me for a chest x-ray. Oh, nothing happened. They just told me that it looked fine. Okay, so when you ask more of those questions, now you know what their results were, right? If they were fine and they didn't get sent for a chest x-ray, that means their results were negative. Oh, I had to go for a chest x-ray. Okay, that means it was positive, right? So then at that point, once someone tests positive for the TB test like this, most likely they will always test positive, okay? So we don't ever do it again. If they've had a positive reaction, don't do the test. Oh, you had a positive reaction? I'm sorry, let me go let the doctor know, because you're always going to test positive, most likely, if you've tested positive in the past. Let me let the doctor know. We won't be able to do this test today, and the doctor's going to order a chest x-ray to make sure that you're not in active tuberculosis. Does that make sense? Okay? So, and I know this is a lot of information, but don't worry, we're going to do it over and over and over and over and over again. Okay? So, okay, so it's negative. Yes?
Yes.
Okay, next question. So we're moving forward. Green light. It's negative. We can move forward. Can you come back in 48 to 72 hours?
Yes.
Yes, I can come back in 48 to 72 hours. Why? Well, we have to check the results. Okay, so we're going to look and see, is it negative or positive? Nope, I can't come back in 48 to 72 hours. I'm heading off to the river. Okay, sorry. Then we can't do the test today. We have to reschedule. Why? Why? Well, because we need to check for your results. So you have to explain these things to people because they're going to ask you, okay? Notice my hair, I'm doing this. Notice I don't go like this, okay? If I do that, I got to go change my gloves, okay? So I'm getting it out of my eyeball, but I'm not touching it with my hand.
Oh, and they notice too.
They will notice, and especially if I'm your patient. So, and you can return in 48 to 72 hours? Great, because we need to read it. How about, are you allergic to eggs? Did anyone ask you guys when you had your TB test if you're allergic to eggs? No.
No.
Yes? Finally! Where'd you get it done at? Thank you. Okay? So we always would ask that. Why? Because somehow, somewhere along the line, the medication is either grown in eggs or it has I don't even know why. It has a something in it, a protein or something in it, that if you're allergic to eggs, you're going to react to the test. So that's why we always would ask. Okay? So again, not all places will ask that, and when you get out there, they may say, you don't have to ask that, but trust and believe, if you work at Kaiser, it's part of what you have to ask. So I teach it to you guys so that you're prepared, and if they tell you when you get out there, no, don't ask that question, then don't. Whatever they tell you is what you do, okay? Oh, you're not allergic to eggs? Great. Again, green light, moving forward. She was negative, she can come back in 48 to 72 hours, and she's not allergic to eggs, right? Okay, so that's it. So now we can move forward, okay? So I need your forearm here. Which arm do we use? Well, it depends on your office. Some offices will say always the left arm. Some offices will say always the right arm. Well, what if they don't have a left or right arm? Same thing with blood pressure, right?
I just do it on whichever one they give you.
Yeah, and some will just be like whatever. But some offices are very strict. Only the left arm. Why? Because if there's 20 people that are doing TB tests and reading TB tests when the patients come in, you don't know where to look, okay? So there's usually a standard. We always want the left arm, and we always do right in the middle, or we always do upper outer. So your office is going to have very specific locations of where they want it, which arm, that whole thing, okay? So in here, practice, it doesn't matter because we need both arms, okay? And it's good to practice on both. So what are we looking for? We're looking for that we're not going to go in any veins. And look at her. She's just obvious. There it is. Boom. Okay? We're not going to go into there.
A big one, huh?
Yeah, it's a big one. So how do we measure? We're going to go from here to here, and we're going to go right in the middle. So I just kind of do that, and then I look. So this is the area in the middle, but there's her vein. So we need to go to the side of it. Okay? We don't want to go in it. We need to go just under the first layer. Okay? Now I need to be able to see what I'm doing. Okay, so here I am. My tray and all my equipment is over here to my right, right? You see I'm not reaching over here getting my stuff. It's just right here. So I'm going to clean this area, and I already measured. And we don't want to get it soaked. Okay, right in the center. Work your way out like a snail shell. See how I did that? We don't go like this. Okay, we don't go like this. Okay, no. We go from the center. Work your way out like a snail shell. You see it? It even creates a little circle like that. Okay? Now, here's our needle. What is this? Rainbow. Thank you. Okay? Now, the bevel is up. Remember we looked at that? See the opening? That's that bevel. It's the opening to the needle, and shine, 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 shine. It picks up the light. And it makes that noise too. You just can't always hear it.
I'm
Shine,
gonna
shine,
think
shine,
of that
shine,
whenever
shine.
I
Yeah.
look.
Shine,
now.
shine, shine. Okay, there it is. Okay. And I'm looking. Yep, my medication's in there. My bevel is up. Okay. I'm going to come right over here. Can everybody see? Come in if you can.
We're gonna be on YouTube.
I'm going to pull this nice and tight. You see that? Now I'm going to come here, and I'm at a 10-degree angle. This is intradermal. And I'm going to go right under that first layer of skin until that bevel disappears. Do you see it? It's gone. Do you see how it's gone? Okay. And you're going to come around. See how my right hand stays steady? I don't move the right hand. Come over here. I'm going to push this plunger in nice and slow. I'm not going to go too fast. And I'm making that little bubble, which is called a wheel. And it's supposed to look like that. Take it out. Drop it. See that? That's what we want. That's a wheel. We want that. We want the medication right there, just like that. If you don't see the wheel, you went too deep. Okay? Sometimes you'll be like this, and you'll go to put it in like this, and it starts squirting outside of here. It's because you're not far enough in. So you would go in just a little bit more, get that bevel up underneath of that skin, and then you're going to get your little wheel. And eventually it just kind of goes away.